Congratulations on reaching the end of your orthodontic treatment and entering the retention phase. We hope you are happy with your new smile. In this video, we will discuss what is a removable retainer, why it is important to wear retainers, a demonstration of inserting and removing retainers, how long retainers will need to be worn for, how to look after the retainers, attending the orthodontist for retainer checks, what to do if the retainers are lost or damaged, and retainer replacement. So what is a retainer? A retainer is a durable, clear plastic material that is moulded to fit your teeth and that you will have to wear as instructed by the orthodontist once your brace has been removed. When orthodontic treatment has been completed, there is a tendency for the teeth to return towards their original position. This is known as relapse. Also, as part of getting older, minor tooth movements can occur. By wearing your retainer well, the new position of the teeth will be stable and there is a smaller risk of relapse. It is important to realise that your teeth are not set in stone and they will try to move back to their original positions if you do not wear your retainers as instructed. Even with good retainer wear, some minor tooth movement can take place as part of the ageing process. If you fail to wear your retainers or do stop wearing the retainers as instructed, the NHS will not fund any future orthodontic treatment if there is relapse, and a private fee will be incurred if you wish to re-straighten your teeth. We will now move on to a demonstration of inserting and removing the retainer. So first of all, you will need to identify which is the upper retainer and which is the lower retainer. Generally, the upper retainer is larger and the teeth appear larger. So once you have selected the correct retainer, stand in front of the mirror and place it over your upper teeth as such. And then press your thumbs gently upwards to get it into position. There should not be a gap between the teeth and retainer. If there is, this is an indication that it is not seated correctly. Please try again. So we will now show you on the bottom. So again, place the retainer into position and then use your thumbs to press down. Please do not bite your retainer into place as this could fracture them. So let's move on to removing the retainer. Always use two hands to do this or you can fracture your retainer. Place your fingers on the border of the retainer on both sides and gently pull the retainer out. Again, we will demonstrate on the top. So use both fingers. It may feel sore and tight at first around the teeth and gums. This is normal, but you will become accustomed to them. If you are having trouble wearing your retainers, please contact us. The removable retainers should be worn as instructed by your orthodontist. In year 1, full-time wear for the initial 2 weeks, only to be removed for eating and sports. After 2 weeks, this is followed by evenings and nights for 2 months, and then for the rest of the year, every night. In year 2, the retainers must be worn every other night. In year 3 and beyond, the retainers must be worn 2 nights a week, but they must not be worn on consecutive nights. As you can see, if you want to maintain the position of your new smile, your retainers must be worn indefinitely. It is important that if you notice that your retainers start to become a bit more tight or uncomfortable, you wear them more regularly, as this indicates that your teeth are beginning to move. So, looking after your retainer. In the morning when they are removed from the mouth, rinse them with water and then use a separate toothbrush and gently brush the retainer with a liquid hand wash for 20 seconds each. Rinse off any of the soapy residue before placing them in a brace box for safekeeping. Don't use toothpaste as this can scratch the retainer material, and never put them in hot water or they will shrink. To help reduce buildup of bacteria and stain on your retainer, we advise using special orthodontic cleaning tablets such as Retainer Bright once a week. When the retainers are not in your mouth, they should be kept in the brace box to avoid damage. Both the brace box and cleaning tablets can be purchased from the practice. Remove when eating and store safely in your brace box as you may chew through your retainer. Clean your teeth and retainer once you've finished and reinsert your retainer. If you have a drink whilst wearing your retainer, take the retainer out afterwards and rinse it, as otherwise the drink will pool in the retainer and hold the liquid against your teeth. This is especially important with sugary drinks as this can lead to decay. Attending for retainer checks. You must attend the practice for retainer checks up to a year following brace removal. After that, we will discharge you back to your general dentist. Remember to always bring your retainer to your appointments, even if you are not wearing them during the day. Your retainers must be checked in your mouth at every retainer check. Unfortunately, if you lose the retainer or you break it, we will need to make you a new one. You will be charged for the replacement as the NHS provides only one set of retainers. Please report to us for an appointment for replacement to reduce the risk of any relapse occurring. Retainers will need to be replaced throughout your lifetime when they become unhygienic, loose or fractured. As the NHS only provide you with one set, you will be required to pay for replacements. Please report to us for any replacements. Thank you for listening. It is important that all of your hard work is not undone now, so please follow all the instructions in this video carefully.